Chronic wounds impact the life of approximately 2.5% of the entire United States population. That is more than 8 million people. When the wound is unable to heal, it can pose a serious threat to one's health and lead to a wide range of other complications. Hello everyone, I'm Daniela Contreras. I'm here with Dr. Scott Zittel from Enloe Health's Wound, Ostomy and Hyperbaric Center to talk about chronic wounds and hyperbaric oxygen therapy. Thank you for having us today, Dr. Zittel.
Thanks for being here.
So let's start with, what are chronic wounds?
A chronic wound is a wound that doesn't heal in a timely fashion. And generally, that means that normal wounds heal over the course of 2 to 3 weeks. And if it's not healing in that duration, you could make the case that that is a chronic wound.
And why do they become chronic wounds? Why won't they heal?
So chronic wounds don't heal for a bunch of reasons. And when we see patients, it's our job to get to the bottom of why that is. Mm-hmm. Those reasons, maybe it's infected, there's pressure on it, there's lack of circulation, there's a deep underlying infection such as bone, or potentially someone's sugars are out of control if they're a diabetic, or maybe they're not getting proper nutrition.
Speaking of that, is there a specific population that is more at risk of developing chronic wounds?
Absolutely. So people that have chronic illnesses are at risk for developing chronic wounds. And also people that are older develop chronic wounds. People that can't move or can't move themselves because of a neuropathic disease or maybe some type of a neurological disease can't get off their wounds and can't relieve pressure, and they're at risk for developing wounds.
And having a wound that won't heal is not something you can just let itself go, right? Like, you need to address this.
Right. It's something that if you're concerned that your wound isn't healing in a timely fashion, then you need to be seen by your primary care provider and talk to them about getting a referral to come see us at the Enloe Health Wound Ostomy Center.
And once they're here, how are their wounds treated?
So we treat wounds in multiple different ways. And it depends on the type of the wound. For instance, if it's a surgical wound, we may use something called a wound vac to help close the wound faster. And a wound vac is a suction device that actually stretches the tissue closed. We may use specialty dressings that help to promote tissue growth, or maybe they help to combat bacterial growth or yeast growth. Potentially, we will remove dead tissue, and we would do that after topical anesthetic by removing dead tissue either surgically at the bedside or sometimes with different dressings that help to remove dead tissue. Sometimes wounds that are complicated by swelling, we'll use compression wraps on lower extremities to resolve the swelling. And then we use our subspecialists, such as vascular surgery, to help us to ensure that patients have robust blood flow to the area.
Oh, great. That is good to know. And then how is pain managed? I'm assuming they're painful.
So generally, some people don't have sensation to their wound area, so they don't have pain.
Oh, that's great.
And you'd be surprised that many people with chronic wounds aren't in a lot of pain from the wound themselves. But of course, we have patients work with their primary care provider to ensure that they do have proper pain medications at home. And while they're here in the clinic, we use local anesthetic to help relieve pain.
Great. And now let's talk about this. Hyperbaric oxygen therapy. How does this play into healing chronic wounds?
Okay, so this is a hyperbaric oxygen chamber, and this is called a multi-place chamber, meaning you can put multiple patients in here at a time. And this chamber works by closing the door, pressurizing the vessel, which is this entire chamber, to 2 atmospheres, which is the equivalent of going underwater about 35 feet. And then after the chamber is pressurized, you breathe oxygen by wearing a hood that is sealed here, and you breathe in the oxygen, and under pressure, that oxygen is driven into your bloodstream. And it goes everywhere in your body, including where you have a wound or potentially a bone infection or something that isn't healing. And it speeds the healing.
Wow, and how long are people usually sitting in these sessions?
So a typical treatment is about 2 hours, and that includes the time it takes to get down to pressurized depth, breathe oxygen at 2 atmospheres, and then come back up to normal atmospheric pressure, which we are at right now. And it's about 2 hours. And they come in 5 days a week, Monday through Friday.
Perfect. That was going to be my next question. How long is the treatment?
It's typically about 6 weeks.
6 weeks. and they can see a progress from maybe not healing to significant healing?
Absolutely. It's a tremendous asset or adjunct to what we do on the clinic side to helping patients to heal.
Great. So Dr. Zittel, what makes this chamber unique?
So this chamber is unique because it's a multi-place chamber, and that means that you can put multiple patients in it at a time. And inside this chamber is air, actually. So you're breathing air at first until you put the hood on and breathe oxygen. So it's unique, first of all, because it's spacious. It's also unique because we can put multiple patients in it at a time. It's unique also because it is not as confining as a monoplace chamber. A monoplace chamber is a plexiglass tube that one person goes in on a gurney at a time, and it's quite confining and small. So if you're claustrophobic, this chamber is much more tolerable.
And not a lot of places have the multi-people chamber?
Right. Most wound centers do not have a multi-place chamber. So this is very unique to Enloe Health.
It's very interesting to look at. So I'm sure people are going to be curious about it. How can people prevent having chronic wounds in the first place, if that's possible?
Well, it is possible. I think that people prevent having chronic wounds by taking care of themselves. And that means good nutrition, exercise, seeing their primary care provider regularly, eating well, and if they do have a wound that isn't healing, seeking care.
Great. And when they're sitting here, can they feel anything? Does it feel different?
Sure. So when you're in the chamber, at first the chamber, when it's pressurized, you feel pressure, much like when you're descending from the mountains and your ears start to pop.
Oh, okay.
Or when you swim to the bottom of a swimming pool, or if you're scuba diving. So patients will need to equalize their ears by either swallowing or blowing with their nose shut. And then they will feel warm at first because the molecules are speeding up as the chamber is pressurized. And then once you're at pressure, you don't really feel anything. But as you come back up to atmospheric pressure, it gets cold.
Oh.
Yeah, so you feel cool.
Wow, very interesting. Very interesting. What is a telltale sign that people can see that their wound is maybe not healing properly?
Well, I think a telltale sign would be that you're concerned that it doesn't look right.
Oh.
And maybe the wound is discolored, maybe it's draining a lot, maybe it's hot, it's red, it's painful, maybe it's impeding your ability to walk or move. And so those are all typical signs that there's something wrong and you need to seek help.
And these wounds, do they happen suddenly, like by accidents, or do they develop over time, or just case by case, everything is different?
There's so many different types of wounds. We treat wounds that stem from trauma, injuries. We treat wounds that stem from surgeries that don't heal. We treat wounds that are from people that have diabetes and don't feel their feet and have poor circulation. We treat wounds that are burns. We treat wounds that are complicated by radiation to an area. Maybe you had an area that was treated with radiation for cancer, and then you develop a wound and it won't heal. So these wounds are multiple reasons. So we treat them all.
Great. Well, that's good to hear. Is there anything else that you would like to add that I didn't ask you?
No, I don't think so, but thank you for coming today.
Thank you so much for having us. And thank you all for tuning in. If you'd like to listen to more Health Matters conversations, visit www.enloe.org/podcast. If you have a topic you would like us to explore, let us know. Email us at healthmatters@enloe.org. See you next time on Health Matters.